You wake up with a pounding headache. You take an ibuprofen, drink a glass of water, and continue with your day. The whole experience lasts less than a minute. Now imagine waking up with that same headache 50,000 years ago. No painkillers, no pharmacies, no doctors, no hospitals, no internet convincing you that a simple headache is something far worse. There was only you, the pain, and a small group of people who had no idea what was happening inside your body. It's easy to forget how recent modern medicine really is. For more than 99% of human history, people lived without antibiotics, vaccines, x-rays, surgery as we know it, or even a basic understanding of what caused disease. Yet somehow our ancestors survived long enough to create every one of those things. How? How did they survive broken bones, infected wounds, dangerous childbirth, deadly illnesses, and all the countless ways the human body can suddenly fail? The answer is far more remarkable than most people realize. Because our ancestors weren't simply waiting to get lucky. They were observing, experimenting, remembering, and slowly building medical knowledge thousands of years before anyone wrote a single medical book. Some of those discoveries are still helping you today. Every time you reach into your medicine cabinet, you're benefiting from ideas whose origins stretch back tens of thousands of years. This is the story of how humanity invented medicine, one painful lesson at a time. To understand where healthcare truly began, we have to travel back almost 2 million years. At that point, survival meant avoiding predators, finding food, and making it through another day. Early members of the human family probably relied on the same instincts we still see in animals today. When injured, they rested. When sick, they searched for warmth. They avoided unnecessary movement and conserved energy until their bodies recovered. Those responses weren't learned. They were biological instincts. For small injuries, they often worked surprisingly well. But at some point, something changed. Our ancestors started doing something that separated them from nearly every other animal. They deliberately began using plants. That may not sound extraordinary until you realize that our closest relatives still do something similar today. Chimpanzees have repeatedly been observed seeking out specific plants when they're sick. Many of those plants aren't part of their normal diet. Some are so bitter they clearly dislike eating them, yet they consume them anyway. Researchers have watched chimps swallow rough leaves whole to remove parasites from their intestines. Others chew the bitter pith of certain trees because it contains compounds that kill the exact parasites making them sick. They aren't doing it because the plants taste good. They're doing it because somewhere along the way they learned those plants helped. If chimpanzees can discover natural medicine through experience, it's reasonable to believe our ancestors could do the same. In fact, humans possessed one enormous advantage. Knowledge didn't disappear when one individual died. It could be shared. A person who discovered that a particular root eased pain could teach everyone else. Those people could teach their children. Generation after generation, small discoveries accumulated. That single ability changed everything. An animal that accidentally eats a helpful plant gains one useful behavior. A human who shares that discovery creates the beginning of medicine. One observation could save an entire family, an entire community, eventually thousands of communities. Long before written language existed, humanity had already begun building an invisible library of medical knowledge. No single person created it. Everyone contributed to it. That slow accumulation of experience became one of our greatest survival advantages. Then archaeology revealed something that completely changed what scientists believed prehistoric people were capable of. In 2023, researchers studying a cave in Borneo examined the skeleton of someone who had lived roughly 31,000 years ago. One leg was missing. At first glance, that wasn't surprising. Ancient skeletons are often incomplete. But this wasn't natural damage. The leg had been surgically removed. The cut was clean. Even more astonishing, the surrounding bone had completely healed. The patient survived. Not for a few days. Probably for years. Think about what that means. More than 30,000 years ago, Before farming, before cities, before metal tools, someone decided that removing a damaged limb offered a better chance of survival than leaving it attached. Then they performed the operation using Stone Age technology, and it worked. That single skeleton forced archaeologists to rewrite the history of surgery. Even more surprising, it wasn't the only evidence. Across Europe, Asia, Africa, and the Americas, archaeologists have uncovered ancient skulls containing carefully cut circular openings. These weren't battle wounds. They were intentional surgical procedures known today as trepanation. Ancient healers removed a section of the skull, probably to treat severe head injuries, seizures, or dangerous pressure inside the brain. The remarkable part isn't the operation itself, it's the outcome. Many patients survived, the bones healed, new bone formed around the openings, proving these people lived long after surgery. How anyone first discovered such a procedure remains one of archaeology's greatest mysteries. There were no universities, no anatomy textbooks, no laboratories. Only observation, experience, and an enormous willingness to learn from both success and failure. Many attempts undoubtedly ended in tragedy, but every successful treatment became knowledge worth remembering. Eventually, those techniques spread across cultures separated by thousands of miles. That tells us something important. Our ancestors weren't blindly following rituals. They were preserving methods that had repeatedly proven useful. Long before chemistry or biology existed, people had already begun practicing the earliest form of evidence-based medicine. The story becomes even more impressive when we look beyond prehistoric caves. By the time civilization emerged in ancient Egypt around 3000 BCE, medicine had become a carefully preserved body of knowledge. One of the greatest examples is the Ebers Papyrus, written around 1550 BCE, but containing medical traditions that were already centuries old. It records hundreds of treatments for infections, digestive problems, skin diseases, eye conditions, inflammation, and many other illnesses. Not every remedy worked. Some reflected the beliefs of the time, but many proved surprisingly effective. Take honey. Egyptian physicians regularly covered wounds with it. Thousands of years later, modern science discovered why. Honey naturally slows bacterial growth because of its acidity, low moisture content, and the compounds it produces. The Egyptians knew none of that. They simply noticed that wounds treated with honey healed more successfully than those left untreated. Observation came first. Explanation arrived thousands of years later. Garlic tells a similar story. It was commonly eaten by workers and frequently prescribed by Egyptian healers. Today we know garlic contains compounds with real antibacterial and antifungal properties. Again, ancient physicians didn't understand the chemistry. They simply recognized the results. The same was true for willow bark, which relieved pain and reduced fever long before scientists isolated the compound that eventually inspired aspirin. Again and again, ancient medicine followed the same pattern. People observed, people remembered. People taught others. Little by little, practical experience became medical tradition. That knowledge was priceless. Every community depended on individuals who remembered which plants eased pain, which herbs reduced swelling, how to set broken bones, or how to help during childbirth. Healers, midwives, herbalists, and shamans became living libraries. If one died without passing on their knowledge, generations of experience could disappear forever. Knowledge itself became a form of survival. Yet despite everything they learned, ancient healers faced one enormous problem. They had no idea what actually caused disease. For almost all of human history, bacteria and viruses remained completely invisible. People saw infection, they saw fever, they saw wounds become deadly, but they couldn't see the microscopic organisms responsible. Every civilization created its own explanation. The ancient Greeks believed health depended on balancing four bodily humors: blood, phlegm, yellow bile, and black bile. Traditional Chinese medicine focused on the flow of vital energy. Ayurvedic medicine described balance through the doshas. By modern scientific standards, none of these theories correctly explained infectious disease. Yet something remarkable happened. Many treatments still worked. Why? Because ancient healers paid close attention to results. If a remedy repeatedly helped people recover, it remained part of medical practice. If it consistently failed, it slowly disappeared. Their theories were often wrong. Their observations often weren't. This careful trial and error allowed medicine to progress even without understanding germs. Researchers have even found evidence suggesting that ancient Egyptians sometimes applied mold to infected wounds. They had no concept of antibiotics. Yet certain molds naturally produce substances that kill bacteria. Thousands of years later, Alexander Fleming would recognize the same phenomenon and discover penicillin. Ancient healers had stumbled onto primitive antibiotic therapy without ever knowing why it worked. Perhaps nowhere was practical medicine more successful than in treating injuries. Broken bones heal remarkably well if they're kept still. Our ancestors discovered this through experience. Archaeologists have found healed fractures in Egyptian mummies that clearly show bones were carefully splinted. Greek physicians later described fracture treatment in impressive detail. Roman surgeons developed specialized instruments for removing arrows, spearheads, and other battlefield injuries. The Roman army even established organized field hospitals staffed by trained medics. Keeping experienced soldiers alive wasn't simply compassionate, it strengthened the army. Although Roman doctors still didn't understand infection, cleaning wounds quickly and treating injuries systematically greatly improved survival. Their trauma care remained influential for centuries. But perhaps the greatest medical discovery wasn't a plant or a surgical technique. It was community itself. Humans aren't built to recover alone. A badly injured hunter couldn't gather food. Someone with a broken leg couldn't keep up with the group. Without help, many would have died. Archaeology repeatedly shows that disabled individuals often survived for years after devastating injuries. The only explanation is that someone cared for them. Someone carried them, fed them, protected them, stayed beside them while they healed. Compassion became one of humanity's greatest survival strategies. Communities that cared for injured members preserved experienced hunters, skilled toolmakers, elders, and healers whose knowledge benefited everyone else. Sometimes the most powerful medicine wasn't found in nature. Sometimes it was another human refusing to leave your side. Devam idiotum. Even with all that knowledge, ancient medicine had limits that experience alone could never overcome. Nothing reveals those limits more clearly than childbirth. Today, most people expect both mother and baby to survive. For our ancestors, there was never such certainty. Every birth carried genuine risk. In many pre-modern societies, between 1 and 3% of women died during each delivery. That may sound like a small number, but most women gave birth several times throughout their lives. With every pregnancy, the danger increased. For countless families, losing a mother during childbirth wasn't an extraordinary tragedy. It was an expected possibility. Children faced even harsher odds. In many ancient societies, nearly half of all children died before reaching their 5th birthday. Not because parents didn't care, not because healers lacked skill, but because infections, poor nutrition, contaminated water, and diseases that are easily treated today were constant parts of everyday life. Surviving childhood was one of humanity's greatest accomplishments. Even a simple fever could become deadly. Ancient physicians understood that fever wasn't always something to eliminate immediately. Many Egyptian and Greek medical texts describe keeping patients comfortable, encouraging rest, and preventing dehydration, rather than trying to suppress every fever. Without realizing it, they had recognized that fever is often part of the body's natural defense. But once an infection spread throughout the bloodstream, there was little anyone could do. Today we call that condition sepsis. Even with modern antibiotics and intensive care, sepsis remains one of medicine's greatest challenges. In the ancient world, it was almost always fatal. When healing became impossible, ancient caregivers focused on something equally important: comfort. They stayed with the patient. They brought water. They reduced pain whenever they could. They refused to abandon those who were suffering. Sometimes that support was enough for the body's own defenses to overcome illness. The human immune system is remarkably powerful. Ancient healers couldn't cure every disease, but they often created the conditions that gave the body its best chance to heal itself. Looking back, it's easy to focus only on what ancient medicine couldn't accomplish. That misses the bigger picture. Despite overwhelming challenges, humanity continued to grow. Communities survived. Civilizations flourished. People crossed deserts, climbed mountains, sailed oceans, and settled nearly every environment on Earth. They achieved all of this while living in a world where a tooth infection could become fatal, a small cut could lead to deadly sepsis, a chest infection might turn into pneumonia with no effective treatment, and childbirth remained one of life's greatest risks. By modern standards, they lived with extraordinary vulnerability. Yet they endured because they combined practical knowledge with something equally powerful: cooperation. Every generation inherited thousands of observations from those who came before. Which plants reduced pain? Which roots eased stomach illnesses? Which wounds usually healed? Which symptoms signaled danger? That knowledge wasn't stored in books. It lived inside experienced healers who passed it from one apprentice to the next. The process may have looked primitive. In reality, it followed the same basic principle that still drives science today. Observe, test, remember, repeat. The tools have changed. The method hasn't. Perhaps the greatest surprise is that ancient medicine never truly disappeared. A remarkable number of modern medicines can trace their origins directly back to traditional plant remedies. Aspirin grew out of willow bark. Morphine came from the opium poppy. Quinine, which transformed the fight against malaria, came from the cinchona tree after indigenous communities had used it for generations. Artemisinin, one of today's most effective malaria treatments, originated from sweet wormwood, a plant used in Chinese medicine for nearly 2,000 years before modern scientists isolated its active compound. The list continues with medicines for heart disease, cancer, and childhood leukemia, all inspired by plants first recognized through centuries of human observation. Modern pharmacology isn't separate from ancient medicine. In many ways, it's the next chapter of the same story. Our ancestors didn't survive because they already had medicine. They survived because they never stopped inventing it. Every successful treatment, every careful observation, every lesson passed from one generation to the next became another step toward the healthcare we depend on today. The next time you reach for a painkiller, remember that you're standing at the end of a journey that began tens of thousands of years ago. From Neanderthals experimenting with medicinal plants, to Egyptian physicians treating wounds with honey, to Roman surgeons caring for injured soldiers, to modern researchers studying compounds hidden inside rainforest plants, the goal has always been the same: understand the human body, keep it alive, and pass that knowledge to the next generation. That's one of the greatest stories in human history, and it's still being written.